and welcome to UK Care World. Today we will discuss about CPR Life-Saving Guide. Let's start.
Hello everyone, and a really warm welcome to all of you care workers and care support workers. This training session has been put together just for you. You know, our main goal today is to build your confidence, to give you the skills you need so you can act decisively if you're ever faced with a cardiac emergency. By the time we're done, you'll know exactly how to perform CPR and use a defibrillator. These are skills that can and do save lives. So let's get started.
Just take a moment to let that sink in. Doubling or even tripling someone's chance of survival, that's the power you hold in your hands. It really highlights the incredible impact you can have. When a heart stops, the clock starts ticking, and every single second matters. What you do in those first few moments, delivering CPR, can genuinely be the difference between life and death. It's safe to say these are some of the most important skills you can have in your profession.
Okay, so here's what we're going to cover. First, we'll talk about your role in saving lives. Then we'll look at how to recognize a cardiac arrest. After that, we'll get into the practical side of performing adult CPR and using a defibrillator. We'll also touch on some special considerations you might face in your work, and finally, what happens after the emergency. Nice and straightforward.
All right, let's dive into our first section, your role in saving lives. We're going to start with the foundation of it all, which is your professional duty when an emergency happens.
So as a care worker or a care support worker, you have something called a duty of care. What does that actually mean in a situation like a cardiac arrest? Well, it simply means you have a professional responsibility to respond and help. The key thing to remember is that you're expected to act within the limits of your training, the kind of training we're doing right now, and of course to always follow your workplace's specific policies. Okay, moving on to Section 2, recognizing a cardiac arrest. This is absolutely critical because before you can do anything, you have to know what you're looking for.
Right, so there are three main things to look out for. The first is that the person is unresponsive. You can shout their name, gently shake their shoulders, nothing. The second is that they're not breathing. You look, listen, and feel, and there's no normal breathing. Now, the third one can be a bit confusing. Sometimes a person might look like they're breathing, but it's not normal. They might be taking these strange, noisy, infrequent gasps. These are known as agonal gasps, and I want to be really clear. This is not normal breathing. If you see this, you treat it as a cardiac arrest.
So, if you suspect someone is in cardiac arrest, you need to act fast. Here's the sequence. First, check if they respond. If not, open their airway. Then, check for breathing, but don't spend more than 10 seconds on this. If they are unresponsive and not breathing normally, you need to do two things immediately. First, call 999 for an ambulance. And second, if someone else is there, send them to find the nearest AED, or automated external defibrillator.
Let's just hammer this home, because these are the two most critical first steps. You need to check for that response. A clear shout, "Hello, can you hear me?" and a gentle tap on the shoulders. If you get nothing back, that's your cue. You immediately call for help. Dial 999. Tell them exactly what you have, an unresponsive person who is not breathing normally. That phone call is your lifeline. It gets professional help on the way. All right, on to Section 3, performing adult CPR. This is the hands-on part. This is where you step in and do something amazing. You manually keep oxygen-rich blood moving around the body, protecting the brain and other vital organs. Getting your hand position right is absolutely key. So what you're going to do is find the very center of the chest on the breastbone. Take the heel of one hand and place it right there. Then put your other hand on top and link your fingers together. This position gives you the most power and makes sure you're pushing in exactly the right place. Now, let's talk about how hard to push. We're aiming for a depth of 5 to 6 centimeters. I know that sounds like a lot, and it will feel deep, but it's so important. That depth is what it takes to actually squeeze the heart and get the blood moving. So please, don't be afraid to push hard. To be effective, CPR has to be deep. Okay, so we've got the depth. The other half of the puzzle is the speed, or the rate. You need to be doing between 100 and 120 compressions per minute. That's pretty fast, right? It can be tricky to keep that pace. A great little trick is to have a song in your head. The classic one is Staying Alive by the Bee Gees. If you push along to the beat of that song, you'll be at the perfect speed. The rhythm of CPR follows a simple ratio, 30 to 2. That's 30 chest compressions, followed by 2 rescue breaths. You do your 30 pushes at the right speed and depth, and then you give 2 breaths. But, and this is really important, If for any reason you can't or don't want to give rescue breaths, that's okay. You should just do compression-only CPR. Just keep pushing on the chest without stopping. That is still incredibly helpful and is always, always better than doing nothing at all.
Okay, let's move on to Section 4, using a defibrillator, or AED. This piece of kit is a real game changer. It can dramatically increase a person's chance of survival. So here it is, a typical AED. You've probably seen these around, maybe at work or in a public space. They can look a bit technical, a bit intimidating, but I promise you, they're not. They are designed for anyone to use, even with no prior training. They're also incredibly safe. It's impossible to give someone a shock by accident. The machine will only do it if it's needed. The best part? It talks to you. It gives you clear, calm, step-by-step instructions. All you have to do is listen.
Using an AED is really simple. The moment it arrives, the first thing you do is switch it on. It will immediately start talking. It'll say something like, expose the patient's chest and apply pads. The pads have pictures on them showing you exactly where they go, so you can't get it wrong. Once the pads are on, you just listen. The machine does all the work. It analyzes the heart rhythm. If it decides a shock is needed, it will tell everyone to stand clear, and then, this bit is vital. As soon as the shock has been given, you go straight back to doing chest compressions. Don't wait.
Here's a closer look at where those pads go. It's always the same. One pad goes on the top right of the chest, just under the collarbone. The second one goes on their lower left side, kind of on the ribs, under their armpit. The reason for this specific placement is so the electrical current can travel directly through the heart. This gives it the best possible chance of resetting itself into a normal rhythm.
All right, Section 5. This is where we talk about some of the special considerations, the real-world questions and situations that you, as care workers and care support workers, are more likely to encounter. This question comes up a lot, and it's a completely understandable worry. What if the person is very frail or elderly? And yes, it's true, there is a risk of breaking a rib during CPR, but we have to be really clear about the alternative. A broken rib will heal, but without CPR, a person in cardiac arrest will not survive. So the choice is simple. The priority is always, always to save their life. You do not change what you do not hold back because of their age or how frail they might seem.
Okay, let's talk about Do Not Resuscitate Orders, or DNRs. This is really important. A person's wishes must always be respected. If you know for a fact that there is a valid DNR in place and you can see it, then you must follow it, and you should not start CPR. But what if you're not sure? What if you can't find the paperwork right away? In any situation where there's doubt, you must start CPR. The rule is simple. If in doubt, start compressions. It's far better to be told to stop later than to not act when you could have made a difference. Now, this training has been all about adults, but it's good to be aware of the main differences for children and infants. For a child, from 1 year up to puberty, you'll generally use just one hand for compressions and push down about 5 centimeters. For an infant, so under 1-year-old, you use just 2 fingers and the depth is about 4 centimeters. The other big difference with infants is that you start with 5 rescue breaths before you begin the 30 compressions and 2 breaths cycle. And that brings us to our final section, after the emergency. Because what you do once the immediate danger has passed is also a really important part of your job as a professional.
So, what happens if it works? What if the person starts breathing normally again? Well, your work isn't done just yet. The first thing you need to do is gently roll them into the recovery position. This protects their airway. Then, you just stay with them. Keep a close eye on their breathing, make sure they stay warm, and just be there to reassure them. Your calm voice and presence will make a huge difference while you wait for the ambulance to arrive.
Before we finish, let's quickly go over the common mistakes, because avoiding these is how you do really good CPR. The biggest ones are not pushing hard enough and not pushing fast enough. Remember those numbers, 5 to 6 centimeters deep, 100 to 120 times a minute. Another common error is people lean on the chest between pushes. You have to let the chest come all the way back up. That's what lets the heart fill with blood again. And finally, don't stop. Every pause in compressions means the blood stops flowing, so keep those interruptions as short as possible.
And that brings us to the end. We've covered the essential skills for CPR and using an AED. I really want to thank you for your time and your focus today. The confidence you gained is so important. Just remember, you are that crucial first link in the chain of survival. What you do in those first few minutes before help arrives, that is what can truly save a life.
So thank you again. The work you do every single day as a care worker and a care support worker is so incredibly important. Now, we'd love to hear from you. We're always trying to make this training better, so if you have a moment,
please do leave us some feedback or comments. Your thoughts really do help us improve this for everyone else. Thanks again.